Okay, it's 6:30. Let's call the August 9th meeting of Health Human Services to order. We have the roll call.
So this meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes. Dale Schleter,
Yes,
Marshall Savitsky,
He's just joining.
Jesse Butcher,
Jesse Betcher's here.
sorry. Michael Maestri,
here.
Chris Rusk,
Here.
Lorraine Gouget, Don Pettit,
Here.
Carol Pearson,
Here.
and we know Dr. Dunlap is not attending.
Thank you. We have-
Hey Dale, can you hear me?
I'm sorry, somebody say something?
Yeah, Dale, it's Marshall Savitsky, I'm online.
Good, yeah, I heard that. Thank you. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, you've had the certification of compliance with the open meeting law. Any changes on the meeting agenda? Okay, seeing none, we'll move on to public comments. Does any of the public have anything they wish to speak? Is anybody here representing the public? Anybody online, public? Okay. And approval of the minutes from our previous meeting. Motion to that.
Second.
Okay, we have a motion and a second. Any discussion? Everybody in favor, say aye.
Aye.
Hi.
Thank you. Motion passed. Public hearing, Health and Human Services 2 and 3 budget. Who gets to run this ball, me or?
You just go in and out of it, I believe, procedurally, do it.
Oh. It's only for the public, yeah, we're not. Okay. I was thinking we were going to talk about it too, but never mind. We need a motion to go into public hearing. And then come back out of it since nobody's here.
I'll make that motion.
Thank you.
I'll
I'll
second it.
second.
Okay. We have a motion and a second. Everybody in favor of going into public hearing?
Aye.
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 Opposed, same sign. Okay, since nobody is here, can I have a motion to go out of public hearing?
I'll make that motion.
Thank you. Second.
Carol.
Second.
Who made the motion? She's asking.
Marshall.
Marshall.
Marshall Savitsky.
Thank you.
Chris, did you make the second?
Yep.
Chris made the second. Everybody in favor, say aye.
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 Okay, motion.
Aye.
Committee reports. I guess we don't have rain. And Tweed's not here. So. Senior Resource Center. I was given nothing to share. We can move on. Adult long-term care.
Administration.
Yeah, I did.
There's nothing for administration other than we're having that list on there every month. As people want to refer to the services in each of the units, just a reference. Okay, yeah.
Okay. Adult long-term care then.
I have a verbal report. We're still working on the transitioning over to the new building. Mr. Alvarado informed me that the vet services are going to stay there, so we'll all be in it together. So I have working with the staff about how we're going to we're short one office and we're trying to figure out how we're going to do a shared office space, remote or whatever, and I think we'll be able to work it out. Also storage, I work with Tim Hagberg. We have to have a certain kind of file system there, and we took measurements, and I was over there with Tim and ordered some type of file cabinets that we need, and we're going to be able to get them all into that reception area. I mean, it just made it with the volume to hold the file, so looks like it's going to work. Also, we interviewed 2 people for the adult long-term care supervisor position yesterday. No decision has been made yet. Also, the Tasha McFadden, who's the regional regional coordinator for the ADRC of the North, was here for that interview, and I took her over and showed her the building, and she was impressed, to say the least, and said this is going to be really good for the ADRC and for APS. So it concludes that report.
It's still gonna be crowded over there, right?
I don't. Well, we'll see. We have to try it. I think it might work. It might work. So.
Okay. No.
All right, you have Alicia Carlson's usual report. I'll just highlight one thing on there. Under her leadership and help from Joe Bodo, the behavioral health clinic got certified again for another year with no deficiencies.
Very good.
So if you know how they do documentation, you can imagine. And then you have your usual report for the mental health cost by client report is on there.
Okay.
Child Protective Services, Carla McKay submitted her CPS report for your review, and last month she talked about what that report entailed, and we also have the substitute care report on there too for the youth placements. And our youth justice, Carla McKay also submitted the YJ report for this month, and once again, last month she went over about what that report entails as well. Economic support, you have Shauna White's usual report. I think next month we'll continue with unit reports, and I think that'll probably be a good month for Shauna to come over and talk about economic support, so you can understand what that report means. And then I'm looking ahead to October. Then we might have Julia present public health for unit report. Speaking of public health, you have Julia's report on public health for your review, if you have any questions for her. I also want to make a comment. I think we probably should clarify this. I did watch the Sawyer County Board meeting, and there was a discussion about how syphilis is passed on, and there was some debate about it. Could you comment and clarify that?
So syphilis is an STI. Syphilis is considered an STI, and then with monkeypox, it was kind of going back and forth between syphilis and monkeypox. Monkeypox is spread typically skin to skin, so a lot of times it does happen through sexual transactions, but not considered an STI. So that was kind of some of the questions. Carry everything with you. Thank you.
Thank you. And then what I will title as the event of the evening is Patty presenting the 2023 budget. And I just want to thank her again for leading the charge on this and getting us through this process again.
Alex, do you want to maybe bring that up for everybody? For the board members that are brand new, let me just go back to how this is prepared. So every year after we have gotten all of our bills and our revenue in for the month of May, which is around the 10th or so of June, we start preparing the budget for the next year. That gives us 5 months worth of data to work off of. At that point in time, I compute an average cost and amortize it over the year. So either if we've done 4 months worth of expenses in a particular area, I'll divide it by 4, multiply by 12. Or if I've got 5 full months and I'll divide by 5, multiply by 12 to try to give us a ballpark of where we're expected to spend for the year. Paul and I meet with each unit supervisor at that point in time, go over with their current budget for the year for 2022 at this point in time. Seeing what is new, what are they anticipating for 2023 as far as changes in programs, needs that aren't being met, any changes that they want to see. We meet with, again, each and every unit. At that point in time, I go back and I prepare a draft budget. Paul and I meet then with all of the supervisors combined and present the budget to them, and they tell me any tweaks that they want to make with that budget. I go then back, and Paul and I met with Andy and Mike, the county accountant, and presented the budget to them. Then the process is to bring it to you. So what you have in front of you it's a 14-page document. What I do, which you aren't online able to see, but I've got folders. I start with preparing a budget for each and every grant that we get. That then rolls up per unit to do a total per unit. Our page 1 is what it comes to take every unit then and total it up, so that this is where Health and Human Services is looking for 2023. You're seeing on the left-hand side our expense categories, from salaries all the way down to indirect costs. Then you're seeing what the total of 2023, both direct and then administration, and then your total. And I'll get to explaining what that means, the administration line means in a moment. You're seeing what your budget was for 2022, and you're seeing the difference between 2022 and 2023. If you go down below that, you're seeing what your county money request was for 2022, what it is for 2023, and the difference between those two. On the right-hand side of the page, you're seeing your revenue. You're seeing what we're projecting for state revenue, medical assistance, client, and insurance revenue. What the total of that is, what our 2022 revenue is budgeted at, the difference between the two. And then below that is just notes of things that have changed significantly from the 2022 budget to the 2023 budget. Those both being, we had an increase in a program TSSF, which is in the children and family unit, solely due to an increase in revenue. So therefore, if we don't spend it, we have to send it back. So basically I balance the budget saying, we're going to spend it, it's offset with revenue. That's the same. We increased the kinship benefit due to a state allocation increase. We decreased youth justice purchase service to reflect a grant allocation. We had a decrease in an allocation, therefore we decreased our costs on that one. And we did increase, we did a projected increase for on-call for across many units that do on-call. So this is, we can circle back to page 1, but we'll go on from there. Page 2 is administration. So administration, we take a cost of what it costs to run the agency, and that ultimately gets divided out to each and every unit, to every grant that will accept administration and indirect cost. It goes out to all of those grants. Some of them, that helps us because we are able to bring down federal medical assistance money. Some of it we cannot. but. So the difference between, on page 1, you saw administration and indirect cost. Administration is what it costs Health and Human Services to exist. It's the cost for the director, for our telephone, for our supplies, for our printing and postage, for us to have staff to run our desk. Indirect cost is what it costs the county to have us here. So that is your maintenance, Andy's salary, Mike's salary, payroll, etc., your lights, your heat for the building. When I compute the cost of county money, I add in indirect cost, but then I back that out because the county, we don't actually pay the county for that, but I claim it out to the grants in case, as in some cases, we can pull down additional revenue. So even though I'm claiming it, it's not, I'm not like double dipping. I am not claiming it that we're paying it plus claiming it as a county expense, just so it. So this, your administration expense, ultimately, you'll see on page 1, here it was $552,456.44. That's what it is on the page 1. That's an allocated expense out to all grants. From here, you're going to be seeing unit by unit. Page 3 is long-term care. It follows the same format as your page 1. Your expenses are on the left, your revenues are on the right, and then you've got a difference on the bottom. You've got 2022's expenses that were budgeted. And then on the right, your revenues for 2022 that were budgeted and the difference between the two. So this gives you an idea of where we're at per unit. Your long-term care unit covers your ADRC, and you can see that on the revenue if you go through what kind of services it's covering. It's covering your long-term care, your elderly, your ADRC, your disability benefit specialist, your elderly benefit specialist. That kind of helps you see what these grants entail. One thing that you're going to notice in the expenses is that the purchase services are such a large hunk of most of these budgets. What you get on a monthly basis from the fiscal unit is the purchase service recap. Why do I give you that? Because totally our purchase services in Health and Human Services for 2023 are $4,952,198. That is a lot of money to not know line by line. Okay, that's what you're budgeting. What does it mean? So this helps you see now, what does that really mean? If we go on to page 4, page 4 is the purchase services for the long-term care unit. You can see this is a helpful tool in for the supervisors as well as for Paul and for Andy and Mike when they look at this. This shows you by category that we budget for purchase services, what we spent all the way from 2011 to 2021. It gives you 10 years worth of data history. It's projecting what we're going to spend in 2022. It's giving you the 2022 budget, and it's giving you what we are budgeting for 2023. Page 5 is that same scenario for the AODA mental health unit. And I welcome any questions, or you can wait till I'm done if you'd like. Page 6 is also the purchase services for the AODA mental health. Now you can see, especially with the Mendota Winnebago, how it has crept up
over the years and why we increased our budget so dramatically in 2021. We started increasing the budget. 2022 is truly when we increased to the 1,100,000 that we've got in that line today. And although you'll see projected for 2022, our Mendota Winnebago is not, it's going to be that high. Our residential care is going to be, they're going to be going out of Winnebago into residential care. So ultimately, we're seeing expenses for that. We also have people on the horizon that are going to be going into. But this shows you the history and how things have gone up so dramatically. A really interesting point in here that I have brought up in the past that you can really see on this is that in 2013 is when they changed the Medicaid rules, and you started seeing your local hospitals stop taking mental health hospitalizations. We went from $19,355 in the state institution to the next year being 177, then 331, then 690, then 721. That's why that's been creeping up. Your next page 7 is your children and family unit. There used to be a separate budget for youth justice that has all been incorporated into one unit now for 2023. Again, the same format of your expenses on the left, your revenues on the right. And page 8 shows you your purchase services with that same historical aspect for the children and family and youth justice. Page 9 is economic support. You'll see economic support is primarily salaries and fringe. The only thing that we really do for a purchase service is we purchase childcare certification out of the agency, as well as fraud investigation services. We are the fiscal agent for the Northern Income Maintenance Consortium. So therefore, we manage the contract for the fraud program. Page 10 is the purchase services then for the economic support. Page 11 is public health. And you can see under the revenue, the various programs. We lumped all the COVID into one COVID line. There are several that we are working off on various years. They go all the way to 2024, some of the allocations. We just lumped it all into one of how much we were going to spend in our COVID or ARPA money during 2023. Page 12 is your purchase services for the public health unit. Page 13 is the last unit that we're representing here, and that is the sanitarian program. It's the sanitarian and the water testing. And again, page 14, then the last page is the purchase services for the sanitarian and water program. Alex, if you could go back to page 1. That really show page 1 then is what all of those page 2 through 14 roll up, and this is the total for our entire agency of all of our budget then, of what we are proposing. Any questions?
Anybody online, questions? Doing fine.
Wonderful job. Thank you, Patty.
Thank you, Carol. Andy, do we need anything on this?
I mean, the committee can make a motion to give it tentative approval to send it on. We already have it in the planning process for the budget.
You're good with it, Andy?
Yeah, I mean, well, I'm good with it as a proposed.
Draft?
Yep.
Okay. I'll motion that.
Sorry, what was that?
Marshall's just being through and something.
Oh,
I would second that motion, Dale.
okay, the motion is to approve and send on to the board. Any further discussion? Everybody in favor, say aye.
Aye.
Anybody opposed? Motion passes. And that will go to the entire county board. Where are we at now here? Lost my place. Where are we at?
It's the budget performance report. That's just showing by unit where we're at.
Please. Any questions on?
And then the next one, B, is the purchase service recap. This is what I was talking about that you receive on a monthly basis. And so on the left-hand side, you're seeing by unit, every category that you saw within the budget. And what the budget was for 2022 and where we're at on spending there. So that gives you a snapshot of that, of the huge amount of money that we spend. You know, because otherwise it's too hard to see where we're spending it. You know, so we created this report so that you could see month by month where we're at on expenditure on those big ticket items.
Car report?
This is a January through June 2022 county car report. This is showing where we're at. So this shows you the expenses, the departments that have used the vehicle, and the savings by having a fleet.
Any questions, comments, concerns? Do you have any concerns about how things are working out with the county cars? Correspondence reports, conferences and meetings, and matters for discussion only. Future agenda items. Okay. We are adjourned.
Thank you.
Thank you.
Thank you.
Thank you.